if you haven't already, go ahead and grab your, if you do have them, your banana and your needle and thread as well, if you plan on participating today. Okay, so we'll go ahead and get started. Start out with our presentation. Okay, so again, thank you everyone for joining us this evening. And today we're going to have a suturing workshop. So my name is Kanaya, and today Amanda and I are going to teach you about suturing. So first, what is suturing? Suturing is a method used to join body tissue together after an injury or surgery. Sutures are a medical device used to close wounds, and stitching or suturing is the technique used to close the wound. So I know a lot of times we may hear these interchangeably, but the suture itself is the medical device, that's the thread that goes into your skin, and then the technique used to close the wound is known as stitching or suturing. Suturing is a minor surgical procedure, thus only trained individuals should suture a patient, and this includes physicians and doctors, nurse practitioners, or nurse midwives. There are several goals of suturing, which include bringing the edges of a wound together, providing adequate tension on a wound, maintaining hemostasis, aiding in wound healing, avoiding infection, and producing an aesthetically pleasing scar. Now, there are some signs that you can use to tell if a wound needs to be sutured. One example is if a wound is deep, gaping, or it has jagged edges. Another is if a cut is on a part of the body that is prone to scarring, like your face. Those type of wounds, if they're wide enough or deep enough, would need to be sutured as well. Also, if a wound is on a part of the body where that limb doesn't function when cut, that would need to be sutured. So an example of that is this foot right here. If you had this cut open on your foot, you most likely wouldn't be able to walk normally. So that's why that kind of cut would need to be sutured. Also, if a wound is on an area and that area is numb, that would be another sign that the wound needs to be sutured. And also, if the wound bleeds profusely after 15 minutes of direct pressure, then that wound would most likely need to be sutured as well. So what are some signs that a wound does not need to be sutured? Well, if the wound has smooth edges that stay together during movement, then you know that that wound most likely does not need to be sutured. An example of that would be this very tiny cut on the finger. Also, if the wound is shallow or short, then the wound would most likely not need to be sutured. And a shallow wound would be anything that's less than 1/4 inch deep, and a short wound is anything that's less than 3/4 of an inch in length. Also, if you have a puncture wound, puncture wounds normally aren't sutured, and that's for two main reasons. The first is that a suture on a puncture wound doesn't really help the puncture wound heal any faster, and it also doesn't help with scarring. Also, if you have a puncture wound and it gets infected, a suture can actually stop the infection from draining from the wound. So it actually would be better in that case to not have sutures on a puncture wound to help with healing. So there are several types of sutures, and there are three main classifications for suture materials. So one is absorbability. So there are both absorbable and non-absorbable sutures. Absorbable sutures are those that can be broken down by enzymes naturally produced in the body. And those types of sutures, because they absorb into the body, don't have to be removed by a physician or a nurse. Also, they're non-absorbable sutures, and because those can't be broken down by the body, they're made by materials that can't be broken down. Those would have to be removed by some type of physician or a nurse. Also, sutures are delineated by structure. So there are monofilament sutures and multifilament sutures. And monofilament sutures are sutures that are just one single thread. And then multifilament sutures are sutures that are made from multiple threads, and oftentimes those threads are put together in a braided nature. Also, there are both natural sutures and synthetic sutures, and natural sutures are made from naturally occurring materials, and synthetic sutures are made from man-made materials. So there are several types of absorbable sutures. One type is gut suture, and this is a natural monofilament suture, meaning that it is one thread of suture, and it's made from collagen found in cow and sheep intestine. There's also polydioxanone suture, or PDS, and this is a synthetic single strand suture used for soft tissue repair and also some pediatric cardiac surgeries. There's also polyglycoprone suture or monocryl, and that's a synthetic monofilament suture used for soft tissue repair. And it is also most commonly used for wounds that we want to heal and have sutures in an invisible manner. Also, there's polygalactin suture, known as Vicryl, and that's a synthetic multi-filament suture good for hand or face lacerations. There are also several types of non-absorbable sutures, one of which being nylon suture, and that's a natural monofilament suture used for general closure, skin, and plastic surgery. There's also polypropylene, also known as Prolene suture, and this is a synthetic monofilament suture used in general surgery, plastic surgery, and even cardiovascular surgery. Then there's also silk suture, which is a natural multi-filament suture. And the cool thing about silk suture is that it's actually made from a filament produced by silkworm larvae. Also, there's polyester ethibond suture, and that's a synthetic multi-filament suture used in cardiovascular surgery. Now, just like there are multiple types of sutures, there are also multiple types of stitching techniques. And this image kind of captures some of the techniques. So today we won't talk about all these techniques because there are a lot, but maybe for those that want to become physicians or nurse practitioners, someday you might learn all of these techniques. But today we'll be focusing on two, and the first is simple interrupted stitching. And simple interrupted stitching is the most common stitching technique. It's called interrupted because the individual stitches are not actually connected. So as you make a stitch, you would tie a knot on that stitch, and then you would cut that suture and you would start a new stitch. So that's why they're called interrupted. And for these stitches, tying each can be time consuming. However, it's advantageous if one of the sutures happens to fail or to break. The rest of the wound is still held together by the other sutures. So that's why this technique is actually fairly common. For each knot that's tied, it's normally a surgeon's knot that's tied, and it's perpendicular to the stitch itself. And also, when these knots are being tied, it's important that whoever's tying them, the physician or the nurse practitioner, make sure that they are on the side of the incision itself, because if they're on top, they can worsen or cause scarring. So that's why it's important that they are on the side of the laceration. Another type of stitching is a simple running stitch. And unlike the simple interrupted stitch, this stitch is continuous. So once you make that first knot and you continue to stitch through the skin, you would, continue to stitch, and then you wouldn't tie that other knot until you're ready and you're at the end of the wound. This involves the same amount of insertions and it's as the interrupted stitch. However, it requires less knot tying, and that can lead to less damage to the skin and also less scarring. This method is best used with long wounds and also wounds that have deep sutures under. And the reason that is because if you have deep sutures under as well, holding the other parts of the laceration together, then if this suture were to get cut or were to get damaged, the rest of the incision would be held together by the other sutures. And so with simple running sutures, the advantageous part is that they are placed much faster than if you use a simple interrupted stitch. However, if you do have one of these stitches break or fail, then the whole wound may open, and that could open you up to more infection. So with suture removal, it really depends on the depth of the wound and also where it's located. So sutures can be in for anywhere between 5 days to 2 weeks, and it really depends on the location. As you see here, for facial wounds, it can be 3 to 5 days that sutures are left in. For scalp wounds or for wounds to the torso, which is your midsection, it can be 7 to 10 days. For wounds on the arms or legs, it can be 10 to 14 days. And then for wounds on the joints, it's also about 14 days. And with sutures, your physician can have them removed after one trip to the clinic, or they can spread it out over multiple trips to the clinic. And that really depends on what's going to help your wound best heal and what's going to limit infection. So when it comes to the actual process of removing the sutures, what you would do is you would use a pair of forceps and you would lift the knot on the suture. At the same time, you would take a pair of scissors to cut the suture right below the knot, and you remove the knot and pull the remaining thread out of the suture. And you would repeat this until all the sutures have been removed. Now, with most medical procedures, there are possible complications. In the case of getting sutures, the possible complication is infection. And there are several possible causes of infection, one of which being that the wound was not cleaned properly before applying the sutures. That's why it's always important to use good hand hygiene and to make sure that a wound is clean before you would apply sutures. Also, if we're talking about an incision that's made during surgery, if the surgeon or the other people that are performing the surgery do not make sure that they follow the pre-surgery sanitation protocols, then that could also lead to infection in the wound as well. Also, if the object that caused the wound or the laceration was unclean, then that can get infection in the wound as well. Or if the wound itself is deep or jagged, even if all the right cleaning protocols are followed, a wound can still get infected depending on the shape and depth of the wound. And in a surgical procedure that lasts for longer than 2 hours, that person may be open to more infection or may be more likely to get infection in an incision. And lastly, if a patient has a pre-existing condition such as diabetes or HIV/AIDS that leaves them immunosuppressed, then they may be more prone to getting an infection in their sutures. And some of the symptoms of infected sutures are redness or swelling around the stitches, fever, pain or tenderness at the wound, warmth at or around the wound, blood or pus leaking from the stitches, and also swollen lymph nodes. And if these symptoms go untreated, then the infection can spread to other parts of the body, and that can lead to abscesses, cellulitis, or sepsis. So in order to treat infected sutures as a physician or as a nurse practitioner, what you would do if you have a patient come in and their sutures are draining and you think that they're infected, then you would maybe take a sample of that drainage and you would send it to the lab. And the lab would be able to tell you what bacteria is responsible for that infection. If the infection itself is localized in the incision, then you may prescribe a topical agent, a topical antibiotic cream to treat that wound. However, if the area that's affected is much larger, then maybe you would prescribe an oral antibiotic to treat that infection. And if the infection is severe and you know that a topical agent or oral antibiotic would not work, then you might also require IV antibiotics for that patient, or even for the skin that is dying around that incision to be removed surgically. And lastly, there are alternatives to suturing, such as staples, surgical glue, and surgical tape. However, these are not absolute alternatives, and they can actually create more intense tissue reaction than sutures. So maybe something like staples would be faster, but the skin won't always agree with staples like it will something like an absorbable suture. So that's just something to keep in mind when trying to pick between sutures and other methods. And now we are going to have a suturing demonstration by Amanda.
All right, so can everyone see the suture pad here and heal me rail? Okay. All right, so with suturing, you're first going to want to make sure that you, of course, wash your hands and put on gloves to protect yourself. If this was real life, you would be handling an open wound, so you wouldn't want to get any of that on yourself. Next, you'll want to clean the wound by washing it out with antiseptic or water in order to reduce the risk of infection. So now I'm going to show you all the tools that I'll be using today. Right here is a suture pad that has multiple types of wounds on it, and I'll be using these three up here. This is what is called a needle holder. It also has 3 spots up here that allows you to push it into place and force the tip to not move. I also have a pair of suturing scissors that will allow me to cut the needle and thread. This is a pair of forceps. And lastly, this is the circular needle and silk that I'll be using to suture into the suture pad. So today I'll be doing two different types of sutures. It'll be a simple interrupted suture and a simple running suture. So I'll start off with doing a simple interrupted suture first. So using the needle holder, you're going to want to grab the circular needle about 2/3 away down. So if you see here, I'm putting it right about 2/3 down. So then using my forceps, I'm going to be using this to lift up the wound, and it'll expose the side of the wound that will show me where I can begin suturing on. And then it pretty much just allows me to see what I'm working with, and it'll also show me how deep the wound is. So what I'll be doing is lifting up the side of the wound with the forceps, and then putting the needle at a 90-degree angle about 1 centimeter to the right of the wound. So when I'm putting the needle in, I don't want to go below the fat. I want to stay in this upper layer of skin. So I'm going to push it through, and then you can see here in the middle, the needle is poking out. And then I want to push the needle through towards the left side of the wound. So all the while, I'll be moving my wrist along with the needle so that it's going through in a circular motion. And then I can pull the needle out with the needle holder. And then all the thread's going to go through, and I'm going to leave about 1 inch to 2-inch tail at the end. This will allow me to create my knot. So about this is enough. So you can see that the thread has kind of made a V shape along the wound. So now using my needle holder, I'm going to be creating what is called a surgeon's knot. So using the needle holder, I'm going to use my left hand on the long end of the thread. I'll wrap it around the tip of the needle holder twice. And then with the tail, I'm going to clamp the needle holder over the tail and then pull the long end of the thread all over. And so this will create my first knot. And so like Maya was saying, you always want to make sure that you create your knot on one side of the wound. So here you see I put it on the right side. You want to make sure that you don't put your knots all along the top of the wound, because that could impede on the progression of how the wound heals. So this is the first knot that I create. I'm going to create at least 2 more knots just to make sure that the knot's secure and tight. But this time I'm just going to wrap the needle around the needle holder once, grab the tail, and then pull on top and then knot it. And I'll do that one more time. So wrap it once, grab the tail, and then pull and knot. So you see that I have my first knot here. I'm going to take my suturing scissors and cut off the tail. And then I'm going to cut off the long end. So here I have my first suture. So since this is a simple interrupted suture, I'm pretty much going to be creating this stitch repeatedly down the wound. And so over time, you're going to see this wound close up. So now I'm going to repeat the same stitch by, of course, taking the needle holder, putting it 2/3 away down the needle, creating a 90-degree angle by the wound on the right side. I will use my forceps to lift up the side of the wound to make sure I'm not going too deep. I want to make sure I'm staying at the upper layer of the skin. And then I'll push through, making sure to reach the left side of the wound. And then letting my wrist just guide the needle through the wound. And then I'll use my needle holder to lift up the rest, pulling the thread all the way through until I create about a 1 to 2 inch tail at the end so I can create my surgeon's knot. So now, using my needle holder, I'm going to wrap the long end of the thread around twice. Then I'm going to grab the tail and then pull off and tighten. So I'm going to do that about 2 more times, but this time just wrapping around once, grabbing the tail and pulling. And then we'll do that 1 more time to make sure it's tight enough, wrapping it once, grabbing the tail and pulling it over. So here I have my second stitch. I'm going to be using my suturing scissors to cut off this tail and then cutting off the long end. So there goes my second suture. And you can already see it's already closing up the wound at the top. Of course, still here it's gaping down, but from the beginning where I started, it's closing up. So I'm going to do just 1 more suture for this simple interrupted suture. So of course, grabbing the needle holder, 2/3 away down the needle, using my forceps to lift up a side of the wound, pushing it at a 90-degree angle, and just making sure I'm rotating my wrist to allow the needle to go through the wound and exit on the left side. And then I can use my needle holder to pull out the rest, and then making sure to create that 1 to 2 inch tail at the end so I can create my surgeon's knot. So that should probably be enough. So using my needle holder, I'm going to wrap it around twice. Grab the tail and then pull all the way through, making sure to create my knot on just one side of the wound. And then of course, I'm going to make sure that the knot is tight by creating 2 more knots. And then I'll just cut off the tail and then cut off the long end. So now if you see, I created 3 sutures so far at the top here, and it has closed off the wound from the top. And then of course you see the bottom of the wound back here. So now for my second suture, I'll be doing what is called a simple running suture. So it's very similar to the simple interrupted suture, except that I'll be continuing 1 long suture instead of making a bunch of knots like this first suture that I made here. So to start off, of course, I'll be using my needle holder, and I'll be grabbing the needle at about 2/3 away down from the tip, just like the simple interrupted. And then I'll grab my forceps, using a 90-degree angle, pushing it through, and then exiting on the left side of the wound. So for this first stitch that I'm doing, I'm going to be creating a knot, just like the simple interrupted suture, but what you'll see is that I won't cut off the long end of the thread because I want to continue stitching through. So let me create my surgeon's knot by wrapping twice around the needle holder. 1, 2, grabbing the tail and then pulling through, always making sure to create a knot just on one end. And then of course, I'm going to make sure that it's tight enough by creating 2 more knots. 1 and then my second one. So here you'll see that I'm going to cut off just a little bit of the tail that I created, but I'm not going to cut off this long thread that I have here, because this is the simple running suture. I'm going to be continuing suturing through the wound without cutting any more thread. So now, of course, I'm going to grab the needle 2/3 of the way down, and I'm going to start stitching, always starting on the right side of the wound. So I'm going to be continuing stitching, pushing the needle through, making sure that it exits on the left side of the wound, and then pulling it through. And then I'll be doing that again. And so over time, you're going to see that as I stitch through the wound, it's going to create a diagonal shape along the wound. You'll see the thread kind of making like a zigzag shape over time. So I'm going to go here with my second stitch, pull it through, and then you see here I've created my first crossover right there. So I'm going to do this a couple more times so that you can see as I go through. I'm just going along suturing without cutting any more thread. So in comparison to the simple interrupted suture, like Naya was saying earlier, this is of course faster because I'm not creating a bunch of knots over time. It's just one long stitch. So push it through. 1 second. Making sure to push through on the right side. Using your wrist to push through and exit. So as you see here, unlike the simple interrupted suture that has a bunch of knots going along, I just created just the one knot up top, and then you can see the needle going, the thread going along diagonally along the wound. So both ways allows you to, of course, close up the wound, but in different ways. So I'm going to create one more stitch, pushing it through on the right side, and then exiting out through the left and pulling it through. So now on this last stitch, I'm actually going to close it off by knotting it. And so it's a little different from how I close off in the simple interrupted suture, and that I'm going to be leaving sort of like a loop in the thread so I can create my knot. So put my needle through. All right, so now I'm going to pull my needle in through the wound and allow my thread to go in, but I'm not going to tighten it. So here you see I've left sort of like a circle up here. This is what's going to allow me to create my knot. So just like with the simple interrupted suture, I'm going to be creating a surgeon's knot, wrapping it around twice, but this time I don't have a tail to clamp on. I'm going to be using this circle loop to clamp on. So I'll clamp on that and then pull the thread over and then tighten it. So I'm going to do that 2 more times to make sure that it's nice and tight. So 1, and then we do that a second time. And then using my suturing scissors, I'm going to cut off the long end and then cut off the circle that I created. Now, comparing the two, you see the knots that I created for the simple interrupted suture, and then for the simple running suture, I have a knot at the top and the bottom, but in the middle, you just have the continuous thread going down. So to remove the suturing, it's pretty easy. All you have to do, like Naya was saying, was you lift up the knots, and then I'm going to cut underneath it. So with this simple interrupted suture, I'm going to lift up all the knots and then cut, lift, and cut, lift, and cut off. So now that'll allow me to just pull out the excess thread that's in here. And then I just have one more for the simple interrupted suture. And then for the simple running suture, for the two knots that I created, I'll lift it up. And then cut underneath. And then same thing with the end here, and then cut underneath. But now for these middle stitches that I have here, I have to cut on one end each time. So I'll cut one end and then pull out the thread, cut one end, pull out the thread, cut one end, pull out, and so on. So it allows you to take out the stitches one at a time. And then this, of course, the last stitch, I have a knot, so it was already cut. So that is how you create a simple running suture and a simple interrupted suture. So now I know a few of you guys may have a banana and needle and thread. So I'm going to show you guys how you would be able to suture that using this suturing pad. Because of course, at home, you're not going to be able to have like the circular needle that I have right here. You most likely have a straight needle like this. So I'm going to be using a straight needle and thread. So if any of you guys have that, you can follow along with what I'll be doing now. So of course, first with your needle, you're going to want to thread the thread that you have through the little hole at the end. So using the thread that I have here, I'm probably going to cut about maybe like a ruler's length, so about like 12 inches. And then I'm going to cut it off. And then using one end of the thread, I'm going to put it through the hole. This may take some time. So I'll put it through. And also, if I'm ever going too fast, with those of you who have the banana, just let me know and I'll slow down so that we could all be doing this together. So now that I have the needle and thread together, I'm going to be creating probably about 3 knots at the end of it, just so that it's secure and never falls off while I'm suturing through the suturing pad and for you guys through your banana. So you're pretty much just creating a knot, just like a knot that you'd create on like a shoelace or end of a rope. Just want to make sure that you do it a couple of times so that it's tight and never falls off. So I've created my first knot here. And then we'll do this probably about 2 more times. If it wants to go through. Oops. Okay, there's my second knot, and then I'm going to do it one more time to create my third knot so that it's tight enough. All right. So now let me cut off this tail so it's not dragging along as I put it through the suturing pad. So I'll cut off that tail. This can go away. So now what you should have left is your needle and then a long tail of thread along the end of it. All right, so now for those of you following along, you're going to, well, also with your banana, make a cut along the skin of the banana. You don't have to like actually go deep enough where you're actually cutting the banana on the inside. You just want to make a cut, just like you see this. You want to be able to have two ends where you can actually like stitch it together. So using like a knife or a pair of scissors, you can make that cut along the banana, but just through the skin so that it's just superficial enough for you to be able to stitch it together. All right, so using this needle, I'm going to go through the, let me show you guys can see that. I'm going to be using the stitch right here, or this wound, excuse me. So go through on the right side of the wound. You're going to poke through and then make sure to exit through the left side. And make sure that you're very careful that you don't accidentally poke yourself. So allow it to go all the way through, and then you can lift it out just like this. And then make sure you leave enough thread at the end so you can create a knot. So here I left a little tail here so I can create a knot. So pretty much just like you tie like a shoe or a rope, I'm going to create a knot so that the thread will be able to stay as I continue putting the needle through the wound. And I'll probably tie it about 3 times because you always want to make sure that it's tight enough and that it won't get loose. Because if this was like a real wound, if the suture were to ever get loose, it won't be able to heal on its own. So I just created my second knot, and now I'm going to create my third one. If I have enough thread, right, and then create it. So make sure you always keep your knot on one end and not leave the knot on the center of the wound. So I'm going to cut off this tail and remove that. So now using my needle, since I left my knot on my right side of the wound, now when I'm stitching, I'm going to be putting my needle through the right side of the wound. Because we're pretty much doing a simple running suture because we're not going to be creating a bunch of knots. We're going to be continuous with our stitching. So now I'm going to go on the right side of my wound since my knot was on the right side and just push the needle through and then exit on the left side. So go all the way through, pull the thread like that. And then now you see the thread exiting from the left side. And so now, as I was saying, I'm going to always be stitching on the right side. So push the needle through on the right side of my wound and then exiting to the left. So if you created your first knot on the left side of the wound, that would mean that you're going to always push your needle through the left side of the wound. Always just pushing the needle through one side. So in my case, through the right side. And then I'm exiting to the left. So over time, you'll see the cut that you made should be getting closer together, and you'll see the thread going across the wound. So if you see here, I have 3. Let me create a 4th one. So of course, pushing the needle through the right side and then exiting out the left, pushing all the way through and pulling the thread along with it. There goes my 4th stitch. So as you can see, the ends of the wound are coming together. I'm going to create one more. So push it through the right, exit through the left, and pull the thread all the way through. So this is sort of like the modified version of a simple running suture. If anybody has been following along and could show me their banana, go ahead and let me know, and I could spotlight you so you can show everyone else. I think Naya has her banana up. Let me show everyone. So her banana, I think she used a red thread, so you can see all the sutures going along the side of the banana. Good job. That looks awesome. So yeah, so that pretty much concludes our suturing demonstration. If anybody has any questions, you could, of course, put them in the chat or say them out loud because we don't have that many people here. Oh, I think Brianna did hers as well. Let me spotlight you. It looks good.
A little bit. I kind of started it late, but I got the first 2 kind of.
Okay, that looks good. Good job. Thank you for doing it alongside with us. All right, so if anybody has any questions, you can go ahead and put them in the chat and we could answer them for you guys.
Did you enjoy one technique over the other?
I would say that the simple running suture was easier to do, only because like you're just literally pushing the needle in and out of the wound in comparison to the simple interrupted suture where you're pretty much creating a bunch of knots over and over, which I feel like takes a lot more practice to be able to perfect. So yeah, simple running suture is easier in my opinion, but there are also a ton more sutures that we didn't do today that may or may not be easier, but comparing the 2 that I did, I'd say super running. Any more questions?
I got one question from someone asking what would happen if you didn't get your sutures removed, and it would leave a scar, like it would leave suture marks in your skin.
Yeah. And I would assume that if the suturing material was actually left inside the person's skin, that could also lead to an infection of some sort as well, I think.
Right, irritation.
Yeah.
For sure. Are there any other questions from anyone? Well, thank you all for joining us this evening. We really appreciate you coming out, and we thank Amanda for showing us how to suture. It's a very good lesson.
I feel like the simple running one is a lot easier because in like 30 seconds, I did like a lot more.
Whoa, you did a lot. Good job.
Thank you.
Yeah,
That looks really good.
Definitely easier. Not creating a bunch of knots. Yeah, it does look good.
That's why those are preferred for long incisions, because could you imagine doing the interrupted sutures for a very long incision? Would not be fun.
All right.
Well, thank you everyone for joining us. And if you have any questions, you can always stay back and ask as well.
Thank you.
You're welcome. Have a good night.